Right there.
Ah, there we go.
Hi.
All right, there we got it.
Yeah.
Excellent.
Yeah. I'm Felicity Greeley, one of the faculty here at TSU Family Medicine.
And Jim Holt. Hi.
Hi. Okay, thank you all for joining us. So we'll go ahead and get started. So how do you see my slides, Brian? And we do have a couple people in the room who, well, at least one person who refused to be on camera. Nicole, do you want to say hello while we're getting the slides going?
Hey, I'm Nicole Moore, the Health Promotion Coordinator for Noswanger, and then I also help with the Read and Play program.
Oops. Yeah.
And unfortunately, like I said, the link that was sent out, I think people had trouble connecting. There were 2 different emails that go out. So if we have anybody else join, we'll pause and let them introduce themselves. But in the interest of time, we will get started. So here we go. Okay, so this is my disclosure of financial interest. That doesn't have anything to do with the content of what we're talking about today, but just in case, that's my disclosure. Not talking about any unapproved devices or drugs. Looks like I'm muted. Okay, sorry about that. We got muted for a second. So the goals of the Read and Play Project Echo are to describe the components of Reach Out and Read and Play for a Bright Future, to help participants apply to become a Reach Out and Read clinic or get involved with Read and Play, engage families around healthy behaviors and early literacy. We'll talk about that. And then also discuss employing a trauma-informed lens in the care of children and families. And this is our first session in the series. It's kind of an introduction and overview, and we'll keep working on recruitment and sending out the right link, because we would love to have teams involved from primary care or other organizations in the community who care for families with children and young children. So that's me. Dr. Tolliver, who is our clinical psychologist in our clinic, has agreed to help facilitate this series, and he is on the call from our clinic with Dr. Jay Schenker. And just a quick overview of the rest of the series. So these are scheduled once a month on the 4th Tuesday from 12 to 1. Dr. Kim Hale, who's Associate Dean in the ETSU College of Education, is going to be speaking on April 4th on early childhood literacy. And we'll certainly talk more about Reach Out and Read and how to become a Reach Out and Read site. Dr. Heather Champney, who is a local community physician, pediatrician, and ER physician, is going to speak on May 22nd about early life obesity prevention. She recently went through the process of becoming board certified in obesity medicine. So she knows the latest and greatest. Dr. Jay Schenker, who's on the call, who's co-director of Read and Play for a Bright Future and director of our clinic, is going to talk about engaging families around healthy behaviors and early literacy. That's something she does extremely well. And July 24th, I will be back to talk about adverse childhood experiences, toxic stress, and trauma-informed care. So we do also, in conjunction with this series, have a funding opportunity. So Niswonger Children's Hospital received a grant from the First Tennessee Foundation, and we have worked with them to make this opportunity possible. So practices in Northeast Tennessee who participate and complete an application to become a Reach Out and Read site can receive $1,000 or at least $1,000 worth of free children's books to help get their Reach Out and Read program going or restarted in the clinic. I did have a question for ETSU Family Medicine. Have y'all been doing Reach Out and Read, or did you do it in the past? Chime in when you.
Still doing it.
You're still doing it?
Yeah.
Okay. So, you know, if you all can participate with us, we need to work on recruiting some more clinics to these calls. We do have a number of clinics in the area who have said that they would like to become a Reach Out and Read site. They were just having trouble calling in during this time. So we are recording all of these sessions so that they can view them asynchronously. But if you all would like to kind of serve as a mentor, having established a Reach Out and Read site, our clinic is also a Reach Out and Read site. I think we're the only two programs in Northeast Tennessee. Then you all would also be eligible to receive this book grant money, because really what we want to do is use this series to telementor these other clinics or mentor these other clinics. So.
Okay, thank you.
Okay. So I think everybody on the call is pretty familiar with Project ECHO. I know you all have participated before. So I'll just go through really briefly. ETSU Department of Pediatrics is a Project ECHO hub. That's something that our chairman established in the past year or two. The American Academy of Pediatrics is actually a super hub that's trying to disseminate use of this technology in practice. So I've got a few slides from the AAP. ECHO stands for Extension for Community Healthcare Outcomes, and it really is to help disseminate medical knowledge and enhance specialty care capacity in underserved communities. So it's a model of telementoring with frontline primary care professionals by specialists. And it uses a hub and spoke model, so that, or one-to-many kind of model. So the team of specialists are the ECHO hub, the frontline providers in primary care are the spokes. And together they participate in monthly tele-ECHO clinics or sessions that combine patient case presentations with didactic learning and mentoring, and that helps to expand reach to patients in local communities of services and expertise. So the session topics are typically determined by an advisory board, and we have a group that included our speakers and folks from CME that put together these session topics. And I will say for this introductory session, we're not going to so much follow the typical format, but for the next 4 sessions, we have our speakers presenting a short didactic. We would love to have case presentations submitted, and there's a form to do that on the ETSU CME Project ECHO website, so that these can also include case-based discussions. And then what's often talked about in ECHOs is management referral criteria, community resources. And benefits of ECHO that have been documented, better access for rural and underserved patients, that's definitely applicable in our area, reduced disparities, better quality and safety, rapid dissemination of best practices, decreased variations in care, greater efficiency, and reduced wait times. So I think we're using Project ECHO in this series a little bit differently than we've done with our ETSU hub so far. So we've had series of echoes on, neurology and cardiology and gastroenterology by subspecialists, and we're here really focusing on health promotion and disease prevention, kind of the other things that we do in primary care. And I'm certainly not a subspecialist, I'm just a general pediatrician that has some subspecialty interests. And I kind of mentioned the backgrounds of our other speakers. So we're just interested in trying out this technology to engage other primary care providers in the area around these topics of health promotion, disease prevention, and behavioral health. So we're glad to have Dr. Tolliver as part of our team. Okay, so let's transition to talk about Read and Play for a Bright Future. So Read and Play is a project that we developed about 8 years ago with support from an American Academy of Pediatrics, a grant initially, and then later funding from the Tennessee Department of Health. And we currently have a grant from HRSA and AAP, which is called Healthy Tomorrows. And a goal of that grant is to disseminate Read and Play for a Bright Future in the region. So we actually have 4 other clinics, pediatric primary care clinics, that are participating right now. And our goal was to include at least 6 other clinics. So we're still looking for some other clinics to join this program. And my hope was with this Project Echo technology that we can sort of build a collaborative. The initial idea for Read and Play for a Bright Future actually came from discussions with a couple of our residents. So they were frustrated with trying to treat obesity in primary care. We know that 1 in 5 school-age children have a diagnosis of obesity. This places them at risk for future health issues and even current health issues, behavioral health issues, and future risk for obesity in adulthood. We also know that the rates vary among different populations, so different ethnic groups and socioeconomic groups. And among young children, preschool, about 14.5% of low-income preschool children have a diagnosis of obesity. That's data from the WIC program, and that's much higher than rates than higher SES, or children in higher SES families. And so my residents were really interested in a way that they could start talking with families, engaging with families around healthy eating, active living, obesity prevention earlier in life. So that's kind of the way that Read and Play came about. Did we have anyone new join the call? And if so, would you like to introduce yourselves?
Helen Johnston.
Okay, so Dr. Helen Johnston, welcome. If you do get a microphone turned on, feel free to chime in, but welcome. We're just getting started. So, really this started out, whoops, what did I do, Brian? I'm not going to touch that again. Like I said, as an initiative to address obesity. So these are the 3 kind of initial goals that we came up with. And when you think about obesity prevention or obesity treatment or other behaviors, we looked at a model called the theory of planned behavior when we were designing this project. And in that theory, there are several constructs that are thought to influence intentions that determine people's behaviors. So those 3 constructs are attitudes about the behaviors, perceived behavioral control, and subjective norms. And our 3 goals kind of fit in those 3 construct categories. So goal 1, engage and educate families around health, safety, and development from birth, or even before. That can help influence attitudes about healthy behaviors. The second goal, increase access to helpful resources. So that can help enhance self-efficacy or perceived behavioral control. What control does an individual have about a specific behavior? And then enhance the capacity of providers and community organizations to engage and support families. So another construct in this model is the idea of subjective norms. what do other people in my peer group think about these behaviors and healthy behaviors. So, you know, you can take the example of feeding my toddler more fruits and vegetables. Sometimes that's not an easy thing to do. You know, if you understand, for instance, how much fruits and vegetables, what types of fruits and vegetables, how to, you know, what the importance of that is for a toddler, how is that different than giving juice? You know, that's going to probably affect your attitudes about that behavior. If you have resources, you know, information about local farmers markets and matching with the WIC program, or, you know, ideas for how you can eat healthy on a budget, for instance, that may increase your perceived behavioral control. And then subjective norms, if you're around other families that are actively trying to feed their picky toddler fruits and vegetables, that's going to influence your perception of how common or how standard this behavior is. So that's just an example of our thinking with Read and Play. So when we started out, we developed a baby book. And we call this a baby book with a difference. It's designed to be used during well-child visits in the first 18 months to 2 years of life. And what we do in our clinic is our nurses give this baby book out at the newborn visit or first infant visit. It comes in a little packet. You know, can they also see me? Okay, so it comes in a little zippered packet. That's what the nurses give out with the baby book, as well as a little healthy, active living tips booklet that those kind of come together. And then what we ask our physicians and providers to do is use these materials to discuss anticipatory guidance during the first 2 years of life. And then we have some posters that kind of reinforce the themes that occur in the book, and I'll show you those in just a minute. But the baby book contains tips that come from Bright Futures and then other practice guidelines from the American Academy of Pediatrics. But these tips are written in the voice of the baby. So the baby is asking to feed me, you know, 5 servings of fruits and vegetables a day. We try to incorporate behavioral approaches into the book. So it's not just a book that families read, but it's more of a workbook. Like a traditional baby book, there's places to put photos, there's places to record milestones and memories, but there's also some suggestions for you know, adults in the family to be healthy role models. That Healthy Active Living Tips booklet has tips for the whole family, and we've kind of organized those around these themes. So play together, be active as a family, play more, shut off the screens, fuel the plate, healthy, and play safely. The tips include suggestions for creating a home environment that kind of helps to support these behaviors. That's called environmental control. And the book is organized around well-child visit, so newborn through 18-month well-child visit. And with each visit, there's some goal setting that happens in the book. These are called activities. So what are you going to want to do with your family and with your baby over the next couple weeks or months before the next well-child visit? So, you know, for the newborn visit, this might include tips like, you know, get help to find rest when you need it, or sleep when your baby sleeps, for instance. And then because there's places to record in the book, that helps with monitoring, right? So that's another thing that helps modify behaviors. So for instance, as you can tell by the title, Read and Play for a Bright Future, sharing books and looking at books in the first 2 years is among the tips in the book. And there are places with each checkup to record the baby's favorite books or books that you like to read or share together as a way of just kind of keep track of that. Just a little bit more about these themes. So we do have a set of posters that we developed because families do spend quite amount of time sitting in the clinic and in an exam room so that they can be entertained by our posters. And they're organized around these 4 themes: play more, shut off the screens, play safely, fuel to play, and play together. So we tried to incorporate principles of social marketing into ReadNPlay. So we've tried to use these themes to tie everything together. We have cute little characters that started with our squirrel family, and kind of consistent graphics, and everything is designed and produced by the ETSU Department of Biomedical Communication. And then the other thing that we hope to do with our posters is promote a healthy office environment. Before we go through the posters, let's see if we can watch a newborn encounter using the baby book. So these are not actual patients, they are actors, but we developed these to help kind of demonstrate how you implement some of these strategies.
Well, congratulations, baby Ella. It's precious. What questions do you all have?
Well, I do have some questions about breastfeeding.
Okay.
Since it's our first baby.
Did you guys see this? I know the nurse gave it to you when you checked in. So this is a baby book. So you can put down all of her data and a little newborn picture there. I think, Doug, you had asked about sleep. So one of those things in here, it tells us that baby Ella needs to sleep on her back, and she needs to sleep on a nice firm surface with nothing else in the crib. So it'll answer some of those questions that you had before about feeding, and then we have these really fun little things where you can document when she first smiles, laughs out loud. I'm not sure if you guys were signed up for the Imagination Library in the hospital.
I think so.
Okay. If not, you can go right here to this website. Just an idea. Sign up and you get a book every month. But one of the wonderful things you can do early on, which we don't often think about because we're sleep deprived, is you can start reading with the baby. Spend some time together every day as a baby. Okay, something that doesn't involve a dirty diaper or doing laundry, that sort of thing. Just even if it's 10 or 15 minutes, a way for you three to connect. Because this is a stressful change. It's a wonderful change, but it's stressful. And then we'll talk a little bit when you guys come back in a couple of weeks for her weight check about starting tummy time. Okay, our stickers that you got up front. Okay, this way you don't have these little stickers floating around in your diaper bag. So right there. Okay. And so you can very easily see how the Ella is growing. The other thing we have in here is fun, healthy, active living tips. You know, for example, in the bedrooms and turn off TV at each meal. That's a great lesson for all of us. I'd love for you to bring this back at each visit so we can talk about it.
Okay, this is an example of how you incorporate these tools into your usual anticipatory guidance with the newborn visit. And you all may recognize Dr. Chiappi, who is our acting pediatrician, and the other 6 medical students who's recently graduated from Poland. Okay, so I'll talk in a couple minutes about the new 2014 AAP policy statement on the role of the pediatrician in supporting early literacy. That's the first time they've ever released a statement on this topic. But for Play More, Shut Off the Screens, I just wanted to highlight some of the changes in the 2016 AAP statement on screen time. So, you know, previously there was kind of that number out there of less than 2 hours a day. And I think in this new statement, the AAP recognized that screens have become a ubiquitous part of our lives, even of the lives of young children. So they talked about concepts of, a healthy media diet for children and having a family media use plan. They actually have a plan that you can use on their healthychildren.org website. In this statement, they made a point that in infants and toddlers, really the priority should be on creative, unplugged playtime. That what benefits the development and emotional well-being of infants and toddlers is kind of that serve and return, that interaction with their parents, their family, other people in their environment, not just watching a screen or interacting with the screen. Around 2 years of age, families may choose to introduce screens and programming, and what they recommended is between 2 and 5 years of age to really limit that to an hour a day of high quality programming. They gave an example of a Sesame Street program, and that you'd really want to watch TV with your kids at this age, again, to make it more interactive and to be able to do some explaining, and not just have it on in the background or have them watching it on their own. For school age, they really no longer talked about the 2-hour limit in this statement, but talked about placing limits, considering the quality of what your school age child is watching or using, and just monitor and make sure that it's not interfering with their sleep or their homework or their participation in sports. That you want to have media-free zones in your house and media-free times, and some of the tips on our Play More poster talk about that. And then too, as a family, you want to have guidelines and rules, and you want to have periodic discussions about this topic, again, recognizing that screens are ubiquitous. For our Play Safely theme, this is our Read and Play house, and it's basically tips for child-proofing, because if we're looking at those first couple years of life, that's one of the things that's really paramount. And, like I said, we initially developed this program to address obesity, but recognize that in children, starting 1 to 14 years of age, unintentional injuries are the leading cause of death, with automobile injuries being the highest among those. And so that we wanted to include that in our focus, and that's, of course, a lot of the focus of our anticipatory guidance at this age. Fuel to Play, Eat Healthy. In community events in the region, we actually have used for several years what we call a sugar model, and we just put teaspoons of sugar in sippy cups and have them in a little case, and then bring along a bottle of juice, a bottle of soda, a bottle of sweet tea, and a bottle of a sports drink. And we ask people to order those from least sugar per cup to most sugar per cup or ounce, like is shown in the sippy cups. And really more than 90% of the time, people get that order wrong, including health professionals. And so it's kind of an aha moment. And part of the point of that is that certain juices, in particular grape juice, actually has more sugar per ounce than soda does. And other juices are just under that. So that's kind of one of those surprise aha moments for people. And then we make the point that we really want our kids to drink water when thirsty and eat a rainbow. So we actually made this poster after having that experience because it was so useful in engaging families in this conversation. We know that the WIC package changed in 2009. And with that change, they actually eliminated juice from the WIC package for infants less than a year of age, and they cut in half the juice that was given to other ages. And so now for infants, or for older infants a year and above, it's 128 ounces per month. And so that's part of the reason we developed this activity in this poster, is that oftentimes juice is sort of the gateway sugary drink, or the drink of choice initially, and we wanted to really make the point that we count as a sugary drink. Sugary drinks are really energy rich, but you tend to still feel hungry after. and don't necessarily restrict calories in other areas. That, you know, sugary drinks are coming in much larger portion sizes these days. And we know that higher amounts of sugary drinks increase risk for obesity, and decreasing can help with weight status. So we just want to get that concept out there early in life. And then play together, again, just emphasizing the importance of healthy role models. And two, just being present with your kids. You know, we try to convey lots of tips for ways that you can interact with kids and play together. And we know this is really important when you think about ACEs, or adverse childhood experiences and toxic stress, and that these are ways to build resilience in families and in children, as well as to help with development and socio-emotional development. So we really find that using these tools has not added time to the visits. It can be done kind of during the same time you would do anticipatory guidance. We have a little set of stickers that our nurses give out at each visit with the weight and height of the baby on it. And we use this as a reminder for the provider to take the book out, put the sticker in the book during the visit, talk to families about what's in the book. Again, that's kind of your usual anticipatory guidance, but ask them to take a look at the book and fill it out between visits and then bring it back with them. And we find that providers who do that, it works. You know, families bring it back. If the provider doesn't ask about the book, they're getting it out and saying, don't you want to see my baby book? And these stickers are also kind of cute and collectible. So we'll just look at a video of an infant follow-up visit.
It looks like baby Jack is doing wonderfully. I understand mom is back at work right now, is that right?
Yeah, it's just a day.
And, you know, kudos to her and kudos to you, because Jack is growing beautifully. I'm very, very pleased with how he's doing on the growth chart. Here is your sticker from today. If you can see, we've really done beautifully with our weight. So let me put a little note in here for mom. Great job with breastfeeding. I see mom has filled in the family tree. That's wonderful.
Yeah,
I am so pleased to see that. One thing I do want to point out to you, as baby gets to be 6 months old, safety becomes sort of paramount for us. And there's this picture here in the back of the book that tells you what sort of things to be watching out for and what to look for as he gets to be 6 months old and as he starts getting out on his own and crawling. So I would love for you all to review this before you come back the next time and look at the 6 month mark, review the tips, and look at the back of the book. I think that's helpful as baby Jack grows.
Okay, so thank you to Dr. Jay Shanker. And again, we've got some of our former medical students here. So back to our slides. The other part of Read and Play, in addition to using the baby book, so we developed the children's book series. And this came from our experience as a reach out and read site. For over a decade, we already were giving children's books out at well child visits. So we just worked with the local storyteller and decided to create our own children's book series. And again, these are kind of children's books with a difference. They're themed, the first book is themed around playing more and playing together, so limiting screen time and kind of creative and active play. The second children's book is around fuel to play, eating healthy. There's some picky little eaters in the story, and visit to a farmer's market. And then our last book with the little owl here is themed around playing safely. So they're children's stories kind of designed for baby book graduates, those toddlers or preschoolers or even early elementary school age kids. But other thing that's different is in the back of the book, there is a reading guide that gives examples of how you can use books in an interactive way and have conversations about the book with the child as you're reading or throughout your day. And then it also has tips for families around the theme, those play themes of the book. So these we use as options when we're giving out our Reach Out and Read books. We've also partnered with community organizations in the region to expand opportunities for peer support around healthy behaviors in the area. So, and these opportunities are all free. And we try to connect families in the clinic to these by passing out flyers. We also post these on our Facebook page. And so we try to and have built up a monthly support group called Mommy and Me. There's always a topic for discussion each time, a guest speaker who comes. It's pretty informal, it's a small group. You know, in the past year, we've had usually like 3 to 8 families come. They typically bring infants and toddlers and young children. It's pretty informal. We work with lactation consultants from Ballad Health, and we've also worked with the ETSU College of Education to develop some children's activities that we have in activity bags to help entertain kids while they're there. And we have medical students and resident volunteers who help with that each month. We're actually moving this to One Acre Cafe, so we're excited about that new partnership starting on April 3rd. And at 1 Acre, we'll be able to kind of reinforce healthy eating by providing a healthy lunch to participants. So on the ETSU CME Project Echo website that kind of highlights this series, you can access session materials, and this flyer, it's actually an updated flyer for the new location, is in that on that website, so you can access that. We also try to put out there opportunities that other organizations have. So for instance, this past weekend, some of our medical students had organized a community fair on campus. You know, over in Elizabethton, there's a big Earth Day celebration that they do every year. So we try to just really have these organized with the details that families need. They can go to the Facebook page for more information. But, you know, that's really helpful if you're talking to a family about how to eat more fruits and vegetables, you know, going out to Earth Day and kind of getting some information about growing food and how people are using local food as part of Earth Day celebration could be really reinforcing. Like I said, all these events are free. Our upcoming event is called Once Upon a Time celebration, that we are the primary sponsor for this event, along with medical students of Quillen, Nicewater Children's Hospital, and the Children's Advocacy Center of the 1st Judicial District. This is actually the 5th year that we've held this event, and it is in recognition of National Child Abuse Prevention Month. This used to be an outdoor event. We moved it to the mall at Johnson City this past year, and that worked out pretty well in terms of increasing participation. We had in total about 600 participants last year. So we're going to have it at the mall April 14th from 11 to 1, just on the lower level of the mall. And all of the events that we conduct follow kind of a similar format. We have activity or physical activity stations set up in tables and stations throughout the mall. We give families a scavenger hunt card to sort of help them know where these stations are and ask them to visit it, at least a certain number of them, and return their scavenger hunt card to get prizes. At Once Upon a Time, we actually have a stage, and we are going to have entertainment, some provided by local kids. We'll have storytellers. We actually do a parade, and we invite participants to dress up as their favorite storybook character or fairy tale character and participate in the parade. And that's led each year by members of the Science Hill Marching Band. We also do raffle prizes. Like I said, this event came about because of Child Abuse Prevention Month, And really the theme from the event came from the local CAC's motto of every child should be safe in his or her own castle. We know in the United States that there is a report of suspected child abuse every 10 seconds. We know that 1/4 of girls and 1 in 6 boys have reported sexual abuse. And we, more and more recognize the effects of ACEs, or adverse childhood experiences. The original ACEs study documented 2 decades ago that people with 6 or more ACEs have increased risk for a lot of conditions, even in adulthood, like heart disease, COPD, liver disease, behavioral and mental health issues. And actually, for individuals with 6 or more ACEs, their life expectancy is decreased by 2 decades. We also know, unfortunately, that there are 4 to 5, that there are child abuse fatalities each year as well. So this event is an attempt to disseminate some education and support for child abuse prevention, but also in a fun way that's non-threatening. So we have a Dare to Share station each year where we distribute resources for families to talk about child abuse prevention. There's one children's book in particular that we pass out that's designed to be a tool to kind of convey the message that secrets, you don't want to keep secrets, and just kind of open a dialogue about safety in the family. And at this booth, participants put a handprint on a banner to kind of pledge to talk about child abuse with their family. And we've each year passed out about 80 of these books, these children's books that are used to be as a tool, and had those families place their handprint on the banner. So it's a pretty unique event. This is our business card that we also pass out in clinic. It has our Facebook and Twitter, and the handle is ReadNPlay. So that's a very cost-efficient way to kind of promote these events and opportunities. And over the past few years, we've been tracking some of our outcomes with ReadNPlay. We've built dozens of partnerships. Like I said, we're really trying to expand in the region. We've looked at enhanced clinical counseling, participation in support groups, community forums and events, and then our social media and social marketing reach. Just briefly, some feedback from mothers, and this is really just about the baby book. So we collected these and follow-up phone calls a couple weeks after the visit. And some of the comments that moms have shared is that, it's like our own baby book, and a lot of our families don't have any other baby books. So they like that it's a keepsake, that they can keep track of their weights and measurements. It reminds them to write down his stuff, his milestones. That there's information in there that people don't know. I think that's particularly true for first-time parents. For instance, I stopped screen time and I started reading to my baby more. Tells developmentally what babies should be doing, how much tummy time babies should get. And with families who do have older children, they've actually shared with us that they use it with their older kids to help them understand what's happening with the baby and kind of, again, reinforce healthy behaviors. We've also done some periodic surveys. These were just anonymous surveys with mothers in our clinic to look at, well, does this actually change behaviors? And we've seen some trends in this data collection with increasing breastfeeding sustainability, decreasing injuries requiring ED visits, increasing the number of babies who have no screen time, and decreasing sugar-sweetened beverages. And like I said, we're still looking for clinics who are interested in joining the ReadNPlay project, and we're actually going to be starting a longitudinal project evaluation with families, so doing some serial online surveys with families to, again, look at the benefits of this program and look at sustainability of it. In our remaining time, I want to just talk a little bit about Reach Out and Read. So this kind of brings us back to where we started as a practice, because like I said, we've been a Reach Out and Read program in our clinic for over 10 years. It was actually one of our former residents, Jessica Tuberty, that started this program. And why early literacy? Well, we know that 35% of US children entering kindergarten lack the necessary language skills needed to learn to read. About half of children ages 3 to 5 are read to daily by a family member. And if you look at children in poor families, the biggest obstacle, or one of them, to literacy is just the scarcity of books and appropriate reading material in their home environment. So I mentioned the 2014 AAP's policy statement on the role of the pediatrician in early literacy promotion, and that was their first policy statement on this topic. So what they said is that the pediatrician should provide advice to families on reading aloud starting in early infancy through about kindergarten age. That they should counsel on shared reading activities, again, how to make it kind of an interactive experience for the child and how to consider the child's developmental level when you're sharing books with them. How to, also that pediatricians should actually provide developmentally appropriate children's books to their patients, and then partner with other organizations in the community to really help make this feasible and make it a priority. So if you look at the 3 components of Reach Out and Read, it really helps you meet the bar here set with this policy statement. So the 3 components are that at each health supervision visit, children receive a new developmentally appropriate book. And for Reach Out and Read, that should say 6 months to 6 years. Medical providers should encourage parents to read aloud and offer practical advice on how to do so. And you want your waiting rooms to provide a literacy-rich environment. So we have a little community library in our book that's kind of a take a book, leave a book approach. And there is an evidence base for Reach Out and Read. It's mentioned to improve the literacy environment, that parents read more to their children, and that both parents and children have more positive attitudes about reading aloud. And then low-income children score significantly higher on vocabulary tests and show improved language development. And this has been documented in lots of studies that reading and sharing books starting in infancy, continuing in the toddler years, that really helps to promote language development and early literacy skills and later school performance. So just back to our funding opportunity again, we have 2 programs in Northeast Tennessee right now for Reach Out and Read in clinics in the area, and we are hoping to increase this to at least 6 in the region or more. And we do have funding to help programs get started. And I mentioned that on the CME website for Project Echo that there's a link you can follow to get session materials. So the flyers that I showed you in this presentation are in there. There's a document that provides an overview of Read and Play for a Bright Future. There's a letter that you can submit if you would like to apply for this funding opportunity and become a Reach Out and Read site, or like I said, with ETSU Family Medicine, help with encouraging other clinics in the area to become a Reach Out and Read site. And then there's also the Reach Out and Read application, so you can actually see what's involved in applying to become a Reach Out and Read site. Those questions are also on there as a document, and Dr. Kim Hale will talk about that more in our next session. So that is all I have, and I know we're just a minute shy of 1 o'clock. We kind of got a little bit of a late start, and like I said, in our future sessions, we're gonna hopefully be more interactive and case-based like a Project Echo typically is. But let's open up and unmute all the lines for any questions that folks have or comments.
I was wondering if family medicine folks could comment on how this project is going in their clinic. What kind of feedback have you received from parents, and how is it kind of on a provider level in implementing some of these things?
For Reach Out and Read,
yes.
We've been
I've seen
giving,
kids since I've been here, like a kid.
we have been giving the books that we receive. I don't know exactly how you're getting the books. You're still getting them, but
Yeah, I think for us, you guys, we've had a lot of challenge. I had somebody else before me had tried to get this going, and then I had tried to get it going, and then I had asked one of our staff to kind of take it on. And I don't think we've ever really had consistency in getting the books restocked. It's always been really unclear to me how that was supposed to happen, and really just no one sort of took the lead on it. So I would say it's inconsistent, would be my description. Would you agree?
I agree. Yeah,
Yeah.
for a while we're not getting them, but now I see new books coming in.
Yeah, so I think that's been our major hurdle.
So I'm the book lady for our clinic, and Dr. Kim Hale actually helps us with reporting that you have to do twice a year for Reach Out and Read. You just have to report the number of well child visits that you had and the number of books that you gave out. And the national organization, Reach Out and Read, if you serve a certain percentage of children from low SES families, you are eligible to receive shipments of books from Reach Out and Read, but they're not maybe as well funded as they were initially, and those shipments are kind of few and far between. I think we get maybe 2 a year, and they're always a welcome surprise when they come. But I have worked for several years on getting little grants and doing book drives and figuring out how to get good low-cost children's books, and have been able to get them now pretty much at $1 a book. And but it's work, and I think we could talk more, particularly in the next session with Dr. Hale, about how to make that feasible and sustainable, and kind of the couple people that you want to have with specific roles in your office. There's lots of training that's really good online for Reach Out and Read, and so we've been able to use some of that with our residents to help with training on this topic and students, so that's the benefit of the program too.
Thanks. Yeah, I'd love to talk more. And I think from our side, our next step is really just to identify who's our point person.
Yeah.
That sounds important.
And then we're hoping that this grant, that this will help take some of that burden off and free you up to sort of figure out how you're going to organize this if you don't have to worry about where the books are coming from.
Right. Right.
Any other questions or comments?
The events that you are participating and supporting.
What was your question? Something about the event?
How are you advertising the events that you are doing?
So we create flyers like I showed you, and then we install those in our clinics, and then kind of educate our nurses and providers and clinic staff that those are there, and actually give those out during the patient encounter. There's one other little video, maybe we'll show this another time. I didn't show it for given our time frame, but again, we incorporate that into the visit, and we love giving those flyers out. Hey, Once Upon a Time celebration is coming up on April 14th. It's free. A lot of your child's doctors will be there. Here's what's going to go on. We'd love to, have you come out. And it's great because families love it. We also typically do something on TV. We try to do a press release, and then through Facebook and social media, we have a ReadNPlay organizational page, and create event pages on Facebook, and I think get the word out that way too. So it's kind of a multi-pronged approach.
Thank you.
Any other questions?
Hey, I just joined Dr. Tolliver for a minute and wanted to say that personal connection is really important. So, in making or in having families attend events, I think the biggest success for me is where I'm able to give them that event flyer and then encourage them to come and suggest that I would be there, or their doctors would be there, the residents would be there. I think that's been the biggest piece, because as we all know, with free events, sometimes sign up may be there, but actually people showing up to the event is very different. And we've now gone several years where some of my families are asking, when is your next event? don't you have an event? Can I not come to it? Because they've been used to coming to it. So I think it's that personal piece that makes people come more than anything else.
And then a couple of weeks before an event, I think most of the providers and staff at the clinic do a good job of rallying around it, and really, people hear a couple times usually before they leave the clinic about the event. And I think that's helpful. It's good as a patient to come in and hear everyone on the same page.
Well, and it's really nice for us, you talk about provider joy as part of the quadruple aim. We really enjoy being able to provide this service and participate. So benefits providers too, and kind of morale.
Yeah.
Excellent. Any other questions? And anyone with any questions about how to get CME credit for this session? I know Dr. Johnston is on.
Yes. If anybody did not get the information on how to check in and claim credit for this, Brian, will you pull that website up again?
We have a new system.
Yeah, there's a new system. Actually, if you are on here and were unable to, or didn't hear the information in the beginning and don't have a new profile in our Highmark system, if you want to just send me an email and I can send you the information, like I did to Dr. Tolliver, that is Wolf, like the animal, WOLF, the letter E, the letter S, and the number 1 at etsu.com. You can also go to our main site here, and we've got to etsu.edu/com/CME, and there are links to create your profile. But if you get in touch with me, I will walk you through exactly what you need to do for today, send you the information on how to claim the credit, and you should be good to go next time.
I guess I'm unmuted. Karen, will any of this go for Virginia?
So definitely we could work with you if you're interested in getting involved with the Read and Play for a Bright Future project. I didn't mention before, but our baby book is going to be available pretty soon as a free mobile application. So we're really excited about that in terms of extending that tool more widely. And I'm not sure about the Reach Out and Read grant funding opportunity. The first information I got that was limited to Northeast Tennessee, but I wonder if you're close enough to count. So I can go back and kind of rediscuss it with them. And then certainly some of these community events and support groups, I know that would be a drive for folks, but we'd be happy as part of participating in the Read and Play project to discuss how you can build partnerships and get things like that going in the region. But certainly in children's books, that would be something we could make available with our grants and getting involved. So I think there's definitely opportunities for Virginia. I'll clarify about the book grant money, because we'd love to have you, if you're interested in building a Reach Out and Read program, we'd really love to expand that in the region.
Yeah, we've looked into it, but we had troubles figuring out the funding, and the sources of books are so low that we didn't get anywhere.
We can help you definitely, because I have many years of experience, like I said, being the book lady in our clinic. So.
Thanks. That sounds great. Thank you.
Wonderful. Okay, so I think we will end here, and we will work on our invitations to kind of get more folks here, but next time. But we really appreciate you all joining in our discussion, and thank you.
Thanks.
Thank you.
All right, I'll see you later. Bye.
Bye.